The COVID-19 outbreak has many of us concerned, but especially about our family members and community members who are already health compromised. Joining me now is Andrea Parator, who is the Director of Patient Care for Hospice of Jefferson County, and Diana Woodhouse, who is their CEO. Ladies, thanks for joining me today.
Thank you.
Okay, so first let's start out with exactly that. What are you guys doing to keep our home care patients and their families healthy?
I think the biggest thing, Alex, is education, just constant education. We are receiving news, updates, interim guidance hourly, whether it's from our local health department, state health department, and things in the news. So making sure that our home care patients, their caregivers and families are really up to the latest and greatest information and what's coming out as far as guidance to go. We also screen all of our patients and families prior to going into the home if we have to make a home visit. So touching base by phone, asking questions about close contact, exposure, how they're feeling, if they're having a fever, cough, any signs of shortness of breath, and doing that screening prior to every single visit.
Families want to be able to visit their loved ones, and I'm assuming that this has probably created some restrictions for visitors. And how are you dealing with that? It's got to be tough.
It's very, very tough. Restrictions on visitors at the home care setting, just as we would here at our own facility. Limiting it to immediate family members or only two visitors at a time, very short visits. And we encourage a lot of our family members to screen their visitors just like we screen them and screen ourselves prior to every visit. Also making sure that, I was in a house the other day and they had signage up, wash your hands, putting that signage up, reminding people that are coming to visit, have you been sick, asking them those questions, making sure that they're washing their hands, and keeping that social distancing as well.
Now, Diana, how is the staff keeping healthy? How are folks doing their everyday 9 to 5 normal work?
Right. So we're really spending a lot of time focusing on our staff because it's really important that we keep our staff healthy or we won't be able to take care of our patients. So we have initiated screening twice a day. We're asking staff to record their temperatures in the morning and the evening and screening to see if they have a cough or any signs of upper respiratory illness, and letting us know about that as soon as possible. So we are following all the recommendations by CDC and the Department of Health. We're doing social distancing in the office. So right now, Andrea and I are in different parts of the building. We're keeping staff that can work from home at home. Many of our social workers, our 3 social workers, are working out of their homes, making calls, asking our home care staff to start from home and do their charting at home if that's possible, coming in only for supplies. So we're a pretty socially close kind of staff, and we're used to having each other around and problem solving at a face-to-face level, but we are doing as much social distancing as possible. Our meetings, our board meetings, our staff meetings, we're going to do those virtually as well. So we're increasing our housekeeping, sanitizing schedule, going around wiping off surfaces more frequently than usual, and again, restricting visitors, the residents. Particularly, not only do we want to keep our patients healthy as they can be, but it's really important to keep our staff working down there healthy. So they have to self-screen every time they come to visit at the residence. We have sanitizer there for them to use going in. We're asking people to pay extra attention to things they don't ordinarily think about. Wash off your phone, wipe it off with a sanitizer, or as in addition, when you wash your hands, wipe off your phone, because we use that piece of equipment so carefully. We're also helping staff or patients at the residence if they want to do and don't know how to do FaceTime calls.
I was just going to say, you mentioned the social workers, and obviously when you reach the point in your life where hospice is necessary, emotionally, mentally, already difficult, what sort of things are you guys doing to help help the patients get through an already difficult time made more difficult.
Right. So our social workers are doing some extra calling to families to see how they're doing. We have some volunteers that have been assigned to families that need maybe some more support, and they're making more calls. We also have some volunteers that are making some masks for us. We usually don't have patients in isolation, so we don't have a large stock of personal protective equipment. So we are trying to get more of that. Mark Walczyk's office called yesterday to see how we were doing. We're working with our state hospice and national hospice organization to make sure we are up to date on any of the latest information, as well as working with our local emergency planning committee. So I think the other thing we're trying to do is really let our staff know how much we care about them staying healthy and that we care about them as individuals. So we are sending out, kind of notes of encouragement every day with some kind of attachment with a special message or something, just to stay connected. We're trying to use humor as much as possible because we know humor does improve one's immune system. Obviously, that has to be appropriate in terms of time and place. But I think the call for the community and what my plea would be is that we really need to focus on our healthcare workers in the community. We're all interconnected. We cannot be lax about what we're being asked to do as a community.
100%.
So, okay, thank you so much.
Well, thank you both. And again, stay healthy and stay in contact if there's anything we can do to help get.
Okay, will do.
All right.
Take care. Bye-bye.
Stay well. Thank you.